Toxidromes, or toxic syndromes, are a set of clinical signs and symptoms indicative of specific types of poisoning or drug overdose. Understanding toxidromes is crucial for healthcare professionals, particularly in emergency medicine, as it guides diagnosis and treatment. This video presentation aims to provide a comprehensive overview of toxidromes, including their definitions, classifications, and clinical implications. The term toxidrome is derived from toxic and syndrome, referring to a constellation of clinical features that arise from exposure to toxic substances. Toxidromes are particularly important in acute poisoning, where rapid identification can significantly influence patient outcomes. The recognition of a toxidrome allows clinicians to narrow down the potential causes of toxicity and initiate appropriate management strategies. Toxidromes can be classified based on the toxic agent's pharmacological effects. The most commonly recognized toxidromes include anticholinergic toxidrome. This syndrome is characterized by dry skin, dilated pupils, mydriasis, urinary retention, tachycardia, and altered mental status. Common agents include atropine, antihistamines, and tricyclic antidepressants. Cholinergic toxidrome. In contrast to the anticholinergic toxidrome, the cholinergic toxidrome presents with symptoms such as salivation, lacrimation, urination, diarrhea, gastrointestinal distress, and muscle twitching. This syndrome is often associated with organophosphate poisoning or exposure to nerve agents. Sympathomimetic toxidrome. This toxidrome is characterized by increased sympathetic nervous system activity, leading to symptoms such as hypertension, tachycardia, hypothermia, and agitation. Common substances include cocaine, amphetamines, and certain decongestants. Opioid toxidrome. The opioid toxidrome is marked by respiratory depression, pinpoint pupils, also known as miosis, altered mental status, and bradycardia. Opioids such as morphine, heroin, and fentanyl are typical culprits. Sedative hypnotic toxidrome. This syndrome is characterized by central nervous system depression, leading to symptoms such as drowsiness, confusion, respiratory depression, and hypertension. Benzodiazepines and barbiturates are common agents associated with this toxidrome. Serotonin syndrome. Although not a classic toxidrome, serotonin syndrome is a potentially life-threatening condition resulting from excessive serotonergic activity in the central nervous system. Symptoms include altered mental status, autonomic instability, and neuromuscular abnormalities. Clinical implications. Recognizing a toxidrome is essential for the timely and effective management of poisoning cases. The identification of specific toxidromes can guide the clinician in several ways. Diagnosis. The clinical presentation of a toxidrome can help narrow the differential diagnosis, allowing for quicker identification of the causative agent. Management. Different toxidromes require distinct treatment approaches. For example, the administration of atropine is indicated in cases of cholinergic poisoning. At the same time, naloxone is the antidote for opioid overdose. Prognosis. Understanding the specific toxidrome can also provide insights into the potential severity of the poisoning and the expected clinical course, aiding the overall management plan. Conclusion. Toxidromes are critical tools in the assessment and management of acute poisoning cases. By recognizing the clinical manifestations of various toxidromes, healthcare professionals can make informed decisions regarding diagnosis, treatment, and patient care. Ongoing education and training in the recognition of toxidromes are essential for improving outcomes in patients with toxic exposures.